All right, what's going on, everybody? This is your COVID-19 daily update brief, current as of March 29th, 2020. We got a lot of information that we need to get through today. I'm going to try to wrap everything up pretty quickly for you. We have a short video I want you to watch on the importance of why we're going to start seeing some larger spikes here in the United States over the next week or two. So bear with me as we dig into the numbers. All right. So again, everything's updated today, 29th of March 2020 as of 15:30 Eastern Standard Time. Right now, we're looking at 711,000 confirmed cases globally with 33,598 total deaths. Those numbers have both jumped up, 63,000 increase in cases and about 4,000 increase in your total deaths. My key assumptions still remain the same. I'm still uh, predicting that we're going to see about 1.2 million deaths by the 4th of April. Uh, the U.S. case fatality rate did go down in the last 24 hours. It was at 9.6% yesterday. The case fatality rate is at 8.8% today. If you're curious how I get that, I'll go ahead and let you read this as I continue on with the video over here, the case fatality rate. But if you've been watching my other videos and you kind of know how I adjust that and how I kind of manipulate those numbers to get the 8.8%. The global case fatality rate is still right at that 3.4. They've seen anywhere as low as 0.4% outside of Wuhan in China, and then they've seen anywhere from 4 to 11% in other countries as this is progressing, right? We don't have a solidified number yet. This will change throughout the oncoming days and weeks and probably months as we continue. So other key assumptions I made back on the 26th, the US would double from 1,100 deaths to 2,800 deaths. At the time, they were doubling at about every 2.5, 3 days. Guys, we're still doubling. It says down here we're doubling in 3 days. That's not correct. It's tracking more like 2.5 days, right? Is when we're doubling. So we're right on track for that 2,800 by the 31st. We're actually, because we're more at the 2.5 days instead of the 3, we're going to probably hit 2,800 by tomorrow. Super unfortunate, super sad. We've gone up from 200 deaths a day, 300 something deaths a day, up to now 500 deaths a day, just about. So very tragic, something we don't want to see, but that is what it is and what's going on right now in the country. The other key assumption on the 27th, right? That Italy was going to double theirs from 9,100 to 18,000 by April 4th. Every 8 days was my assessment, right? Even though they're doubling every 7 days right now, I assessed that they would kind of continue to come down off that. So yeah, those are all the key assumptions. Let's get that out of the way. Now let's go into what happened in the last 24 hours. So as I said, United States is doubling every 3 days. United Kingdom every 3 days. Well, United States is more 2.5, right? Let's continue to track that. France, Germany, and Spain every 4 days, and then Italy is still doubling about every 7 days right now. Here are all the deaths uh, that we're currently at for each country. Again, very tragic. Don't want to see it, and then the percent growth between yesterday and today. So the United States is down as far as percentage goes. Yesterday was 34%. Today they're at a change of 26%, so that's good. United Kingdom was at 18. They're up to a 21% growth in the last 24 hours. France went up to 31%. Germany is down to a 20%. That's a huge difference, right, between 33% yesterday. Spain went down from 18 to 14% in the last 24 hours. And then Italy, again, we've been seeing Italy jump anywhere from 7 to 10 the last 3 or 4 days. So they've been pretty consistent with their growth rate right now. Um, yeah. So if we look over here, we're following this chart. What I kind of want you to continue to pay attention to is both Italy and Spain had these big, huge increases, right? Where we saw a big spike in numbers, right? We're starting to kind of see that with the United States and with France as well. We can probably expect that is going to happen with the United Kingdom as we see more cases and more confirmed deaths come in. But we'll continue to track that. What we don't want to see is that J hook that's starting to happen. Unfortunately, what the media saying as far as the cases confirmed, I mean, there's a lot more out there than what any of us know. And again, I want to show you this quick video which basically highlights that. So these guys over at Tectonics, put this video together. They got some metadata, some geospatial data from people's cell phones when they went on spring break. And I'll go ahead and I'll let this video kind of explain it. It's just a minute long, but it's a very informative, pretty awesome video. Uh, and by awesome, I mean scary.
We wanted to see the true footprint social gatherings like spring break beach crowds could really have on our society in the face of a global pandemic. To do so, we started with the big picture, powering our engine with billions of anonymized location data points from mobile devices across the globe. Using tectonics, we can then zoom in on specific regions. Here, we focus specifically on just one beach in Fort Lauderdale during the month of March. Again, each of these data points shown on the map corresponds to a unique mobile device active on a given day. You can see clearly that device activity spikes during the 2-week stretch of early to mid-March corresponding with spring break. No surprise. Now, using an analysis called a spider query, we can actually track movement of these devices over the remaining weeks of March, seeing where these devices went after spring breakers left the beach. As we zoom further and further out, it becomes clear just how massive the potential impact just one single beach gathering can have in spreading this virus across our nation. It can be hard for us to realize sometimes just how connected our world really is, until the data tells the stories that we just can't see.
Man, super frightening. Let's go ahead and we're gonna bring it back to this point. I want to keep it paused. So as we see, all these people that went on spring break down in Florida back in the beginning weeks of March, right, have now spread across the United States. And we are just now seeing a lot of those people, a lot of those patients that did have coronavirus outbreaks are spreading it far and wide, right? So that's why I'm assessing right now that over the next few weeks, we haven't even hit our apex and we haven't seen the apex as far as confirmed cases and confirmed deaths probably for the next 3 to 6 months throughout the entire country. Places like New York and New Jersey, they're saying they're expecting within the next 20 days they're going to hit their apex. That's crazy, guys. 20 days. We've already had a lot of crap that's going on in the hospitals with the nurses, the doctors, the EMS, the first responders. These guys are already overloaded, right? We're already running out of supplies. And to think that this is going to continue to ramp up and won't even peak for another 20 days, is what the experts are saying, is just mind boggling. So, yeah, we're going to continue to kind of monitor this every day. I'm going to give you your briefs. Anything that I find relevant or good information, I'll kind of share it with you guys. And yeah, I'll just give you your update brief tomorrow.